I've been OT for over 10 years, and my first job was at a general rehab center. And so I think it's important to know that background, that I've seen that side of things, as far as just general rehab floor. And that's just where I kind of fell in love with spinal cord injury and brain injury, because they had their own floor. And I started kind of a clinical research there. But they only had about 10% of spinal cord injury. So it wasn't their like main clientele. And so I've seen that side of things, but then I moved to work at the Shepherd Center, which specializes as a model center for brain and spinal cord injury. And so all the education was there, you know, in comparison to that rehab center where I started. So that just kind of a little background. And I did full-time on the adolescent team. And so you've got very motivated teenagers that are able to do some crazy things, but also there's that emotional component as well. So just so you know, kind of my background. I mean, the major one is packaging. I mean, packaging, because there's nobody else like y'all as far as the packaging that the compact set comes in. And so it opens up the world for a lot of clients, but also the fact that it's sleek, it has that sleek design. So you got buy-in from a lot of clients that might otherwise be like, no, I can't have that in my backpack, or that's too much. So, you know, we worked on hours on trying to open these old packages of, you know, and you'd get your thumb in there and the package would break as you're trying to open it up. You know, just the frustration with different catheters. And so I really like the packaging and the way that it's set up, but also inside, the rigidity of it allows someone with a higher level injury a little bit more ease to insert, because it's not flimsy all over the place. You know, they're already working on themselves to stay where they can insert. So it just allows more independence for my clients, for especially C6 level of injury, but just dexterity in general. I've also had some really like super quads that were able to do it at a C5 level of injury. There's got to be a lot of buy-in at that point. But that's kind of my reasons why I would go that way. The nice thing about it is the way that the design is, it's easy to kind of pick up with a tenodesis grasp. Some of my clients can do this without gloves on, like Dyson gloves on, but then some of them need to have the Dyson gloves on in order to give them more traction. So I don't have any on today, but they're just kind of the palm ones. But the first start is this little tape is the first part. So there's the question of, do you have your caregiver snap all of them and make it easier? Or do you want to be able to make sure that you do them all the time? You're able to do it, because the concern is, what if one of them isn't snapped and you're in the bathroom and you can't get that tape off? So some clients like for their mom to open this part. You know, it just depends on burden, because this is the hard part. So you have to take it, and you're going to take the tape off with your teeth. I've had some parents that cringe. They're like, I spent so much money on those teeth. So we just kind of rotate it, and using your hands to kind of rotate the catheter and spitting that out. So from there, you're going to find a place to bite it. With these two hands, you're going to rotate. And so this can always be a tricky time as someone's trying to figure out which way to rotate it. Pull that off. So we were really thankful when y'all got rid of the Velcro that was in here, the little circle, because that was a really tough point. So from here, it's just getting this part of the bag open, which normally I would put it on my leg to do it, but keep it inside the video. So then I have that open. So mind you, I still have gloves on, and I probably would have already kind of put my pants down if I'm a male, had my anatomy out. A lot of times we'll teach with a bungee cord. So the bungee cord is up in the pants and we push the bungee cord over the knee. So then the pants come down, just because that can hang at the bottom of the wheelchair versus the pants clip. If we have the pants clip, then it's just another thing to have to carry around. And we like the pantler that y'all came up with. That's been nice too, because it's another thing to use. But again, it's something to carry around. So if they can do it with a bungee cord, then we'll go that route. So anatomy's out, just so you know the setting. So at this point, I still have my gloves on if I'm using gloves, or my hands are still dirty because all of this is dirty. So I'm going to bite up here. Use my hands to rotate and pull out. Okay, at this point, I have to hold this, wash my hand, take my gloves off, wash my hands, wash my hands, and then I'm gonna grab. So a nice thing about this is that you have this handle here so that I don't have to touch the catheter if I don't need to. So you can hold my anatomy and insert, and then once I'm in, can use this hand to help bring pressure in to put it in all the way in. Some clients will have to use their other hand to kind of guide it in, you know, depending on how shaky they are or whatever. But a lot of ones will get good enough to just kind of insert in. And that's where like the rigidity comes in handy. And then once it's in, because you've got kind of this place to hold, you can kind of hold the pressure in for it to stay there in order for you to get time to get your thumb in or whatever, to pull it out, unless they're able to kind of pull it out like this. But that's it. Afterwards, either, like I said, kind of pulling it out like this and holding it, you know, or getting the thumb into the other part and holding it like that. But typically I'll have them do their IC by a trash can so that they can then take it and just throw it into the trash. If they can't, then they just kind of put it on their lap and take it to the trash can. We don't do any emptying because it's just too difficult. So the whole thing goes in the trash.